Medicare will only authorize a certain amount of visits. Medicare will only authorize one visit a week. This is what my agency is telling me. I've had enough questions related to this and comments that I'm going to give an honest opinion. And it certainly is a red flag for you to be aware of with home health care agencies. I'm speaking strictly of traditional Medicare, not managed care, because managed care is typically paid by the visit and the authorization process is different. So I'm talking about agencies mostly chase the traditional Medicare. Traditional Medicare, this is for clinicians out there so you know, pays home health agencies a prospective payment for each 30-day episode of care. It's a system known as patient-driven groupings model. This prospective payment is predetermined. It is a fixed amount that is adjusted based on a patient's clinical and functional characteristics and is determined by factors including what's in the OASIS. For a home health agency, keeping therapy visits low each week is more often a business decision than it is about indication or whether they are able to get those visits because of the insurance. Changes to reimbursement, the system, I think in 2020-ish, meant that agencies no longer benefited financially from increasing therapy visit volume, and agencies can kind of aim to hit the sweet spot for reimbursement and for making money. Somebody mentioned in my last video about maintenance therapy being covered by Medicare, because I was saying that's not what Medicare is for, that's not the goal. And that is true. The commenter was, it's true, but in most cases it's because you front load. Then you maintain, and you can't maintain for that long because Medicare won't even let you do it without a lot of documentation for the indication of the maintenance therapy. Somebody else mentioned about all of the clinicians, PT, OT, etc., having to share a certain amount of visits. Like you have 8 visits and you all have to share them. That's not true. A home health agency should have each discipline come in and give their plan of care, give their reasoning behind what the patient needs, the indication, and based on the specific needs of that patient, that's where the visits come from. If a patient is a stroke victim with residual impact, why would I do therapy once a week? Maybe it's indicated to do 3 times a week for 2 weeks, twice a week for a couple of weeks, and then maintenance, once a week for 2 weeks. For the majority of patients, giving as little visits as possible is not what is best. How are you determining whether that patient can do the exercises appropriately that you're giving, etc.? And it's not that Medicare is denying or only giving a certain amount of visits. Often it is reduced access to care for those who truly qualify, who would qualify in order to maximize profit. Perhaps this is not your agency. I'm not saying that it is. I'm just educating of what goes on out in home healthcare land. And always choose an agency that puts the patient first and understand how this works so you can determine whether the agency is managing patients safely.